Women's health has always been a key issue in any health system. They're the foundation and the start of all of our communities, and so we really need to look at ways that we can support and help them. Traditionally, women and children health needs have been somewhat marginalized because others are seen as more acute, but it's a foundational piece and something that Medicine Hat is really works to make sure that we provide good care for women and children and childbearing ages and through their childbearing needs. The kind of equipment and facilities that the Health Foundation provides has really made life lots better for patients and for their babies, for the professionals trying to provide that care. Everything from cots that are updated, a little more convenient, easier to clean, provides better care, better sanitation for the patient. Monitoring equipment that really makes it easier to provide good care for expecting moms, particularly moms in labor. It allows the team to be a better part where some of the remote sensing equipment, for example, remote monitoring equipment, really makes it easier for the whole obstetric team to be involved and help with care of an individual patient that might be has some troubles, or a baby's having some troubles.
So I ended up finding out I had breast cancer in 2023. I ended up having to have a double mastectomy as well as chemotherapy here in Medicine Hat. I didn't end up needing radiation, so I was able to do both of that here in the Hat, which I was absolutely grateful for. I think women's health is always something that we should be trying to strive to improve. I think one thing in particular is removing the stigma surrounding talking about women's health issues, whether it be breast cancer, perimenopause, menopause. I think those are all things that we need to have more open discussions about. I've known other moms and I've talked to in the community, and a couple of them actually have lumps in their breasts, and they were actually afraid to go talk to their doctor about it because of fear of what's going to happen next. They just didn't know what was going to happen, and it caused them a lot of anxiety, and they didn't know what it would look like for them, if it was cancer, if it's not cancer, if it's just a benign cyst, or if it's something that's going to affect them for the rest of their lives. So that's definitely something I think that we need to address, is maybe make more open conversations. There is an enormous amount of people that have helped me through this. I would say the first one would be my family doctor, Dr. Naz. She was absolutely amazing. I approached her and she was empathetic. She listened, she heard me, she immediately got me in for an ultrasound, and I've never felt more heard, ever, when it comes to a medical issue, is when I went and saw my family doctor. The next I would say is I was able to get into Dr. Abraham. She's a surgeon here in Medicine Hat. She was able to squeeze me and get me in right away, because from the time that I found out that I actually had a tumor to when I could get into surgery, it had grown like double in size, and it had to come out immediately so that I didn't end up getting it into my lymph nodes. So the fact that I was able to have my surgery here, I didn't have to leave my girls. I was able to stay in the hospital for a couple nights and then come home to with my girls. It was absolutely amazing. And then being able to do all my chemo here was absolutely phenomenal. My chemo, and then again, I went home to my girls. And as a parent, I know not all women who have breast cancer are parents, but as a parent, like, to minimize the impact of what I'm going through on them was really important to me. Because I know one day, because I have the gene mutation, they will at some point have to go for genetic testing as well to see if they have the gene. And I don't want it to seem traumatic, although I am so grateful to everybody, because it made a difference in my life and my kids' lives and my husband's life. And I am so grateful I was able to be here and not having to travel back and forth between, let's say, Calgary or Lethbridge or any other location that was required for me to receive my treatments. Thank you.
Unfortunately, women and children's healthcare in the province of Alberta, and specifically Medicine Hat, is chronically underfunded. It's not as flashy as the cardiac or the hips and the knees, and it's definitely a need that's very important to our location in Medicine Hat. Well, we've been very lucky to have been moved into the new expansion of the Medicine Hat Regional Hospital since December of 2018. Our operating rooms are state-of-the-art with equipment that doesn't necessarily have to be on the floor. We've had patients come from other hospitals in the province of Alberta and are very impressed with the cleanliness, the lighting, and the utility and safety of the operating room. On our labor and delivery ward, we have very expansive rooms, so we're not feeling cramped. We're able to have mom and babies stay in the room, which is very nice. And the operating room is very close to the Medicine Hat delivery room, so again, patient safety is optimized by having a very clean, new, modern institution. Well, one of the benefits of our new improved facility was the integration of a electronic field monitoring system. It's called OBIX. That has been very useful to have all members of the team either here in Brooks or in other places in the province that they can actually see the fetal heart rate tracing in real time and able to make decisions which are very impactful to the baby at the time. This can be something as everything is fine, or we need to make things happen. So the OBIX system was granted by the gracious donations from the members of our community. We also have other equipment that's available specifically in the operating room. We have different surgical beds for different specialties, and that's also allowed us to have different equipment that meets our patients' needs.
I'm actually going to share a story that about a patient that was here with his wife. They were visiting from up north. They are originally from Edmonton, and they were here actually hunting, and he actually had a stroke while he was here. He was obviously cared for us locally here at Medicine Hat Regional Hospital. Had neuro support. We have the neurologist, but also the entire team. Because of the great care they received here at Medicine Hat Regional Hospital, they actually have relocated to Medicine Hat just because of their positive health experience and the way the community has had supported them.
And when we support healthcare in Medicine Hat, we're supporting our neighbors, our friends, our families. I think it's really important that we support health because we're all going to need it at some time. Women's health is kind of new in Medicine Hat. We're developing it still, so there's some things we don't even know we need yet. As a community and as a user of the system myself, I feel that in giving to women's health specifically, I think we're going to see more women utilize our healthcare and more women get the help they need, whether it's through our clinics or even mental health. I think that we're going to see more and more people come to our clinics and get the help they need. So by donating to women's health or donating to healthcare period, we're going to allow the accessibility for people to come in. So by doing a generous donation to us here in Medicine Hat and women's health, it'd be really welcomed.
Breast cancer is one of the fastest growing cancers, especially for women. The current Canadian statistics say that approximately 1 in 8 Canadian women over the course of their lifetime will be diagnosed with breast cancer. And we are starting to see breast cancer in younger and younger individuals and more frequently. By optimizing and improving our breast cancer care in Medicine Hat, we'll be able to optimize women's health. So currently what happens for women when they come with a breast cancer that we cannot feel is that it has to be localized. And the way we do that on the day of their surgery is with a wire. The patients come in, they go down to diagnostic imaging, they get an ultrasound, and a wire is inserted into their breast. The wire procedure is uncomfortable. It limits how many breast cancers we can do in a day in terms of surgical management, and the timing and coordination of the surgeries become more difficult. The current standard of care across the world, and in particular in other provinces in Canada, is non-wire localization. And we do that with seeds. There's a few seed platforms on the market But we're looking at the Centimag and the MagSeed platform. It would involve insertion of a seed into the breast cancer that we can localize in the OR using a handheld device. That seed could be placed months before surgery, especially if people are going for chemotherapy. It can be placed in any facility, whether it be Medicine Hat or Calgary, and it facilitates timely and appropriate surgical management. The other thing is that our surgery would not be dictated in terms of incisions by where the wire is. So that allows patients to have a good surgery with a better cosmetic outcome. Our goal in Medicine Hat is to make sure that women who are being treated in our facility have access to as good a care as they would get in the tertiary care centers like Calgary or Edmonton, where this technology already exists. We've been really fortunate through the generous donations of the Health Foundation already in terms of our breast cancer care. We've been able to purchase a second probe to allow us to do sentinel lymph node biopsies. We've been able, through a generous donor, to get intraoperative mammography to better image our specimens. And as we look to optimize women's health, and in particular the care of breast cancer in our community, non-wire localization platforms are the next important thing to access. As stated, this is already standard and implemented in numerous hospitals across Canada. Our goal is not to get the latest and greatest technology. Our goal is to keep up to date with the other hospitals around us to make sure that our patients have the same access to care that you could get at any other site.